Hi, I'm Dr. John Harper from Oceanside, California, and I'm speaking with Dorothy Sullivan from Vista. And Dorothy came in from one of our peripheral neuropathy ads. Tell me about some of the health issues that you were struggling with before you came in here.
Well, I'm a recovering colon cancer patient, and I've had irritable bowel syndrome, which was quite active, and just sometimes I had a lot of back pain, and I was having bad pains in my hands and my feet and my legs. Leg cramps wake me up at night, and it was just like someone stabbing me with a knife. And I was taking medicine for it, which gradually things got so bad that I was thinking about giving up driving and making other arrangements. I live out in the country, so that really is a problem.
Yeah, that would have been a tough thing for you. So so you came into the office, and do you remember the things that we were telling you that was wrong with you? What kind of issues? Like we were talking about peripheral neuropathy. We said you had damaged nerves. You also said you had some problems with the discs.
The neck.
Yeah, you had some problems in your neck, and that was affecting your hands, and then also some issues in your lower back.
Yeah.
So when we did our evaluation, did that seem like a different kind of an exam than you've ever had before?
Yes, very thorough, and found out things I didn't know.
Okay, very good. And then when we explained what was wrong, was that clear to you? Did it make sense what we were talking about?
Yes.
Great. And then how about when we talked about the schedule and the financial part of it, was that all real clear to you as well?
Yes, it was.
Okay, great. And how long have you been here?
I think I came in August.
Oh, okay, very good. So a few months.
Yeah.
And in that period of time, what improvements have you noticed?
Well, my handwriting is better, and I can open a bottle of water.
Good.
And I can snap my fingers. I don't know when I'd ever use it.
Yes. Yeah, I remember when you got here, you couldn't hardly move your fingers properly, and now you can snap them like no problem.
And driving, my hand would go numb, and it would be painful. So while I was at a traffic light, I'd have to put my hands down on my lap and sort of massage them. And
right. So no concern about losing your driver's license, is there?
not now.
No,
Thank goodness.
Yeah, good. And then how's that irritable bowel doing?
I only had one problem, and I think it was something I ate that I shouldn't have. That
I see.
was
Okay.
had some things in it. I read labels now.
Good. And so how often were you having problems with the irritable bowel syndrome before? Was that a pretty regular problem?
It was, and it was. If you've never had it, you don't realize. Sometimes you hope you can, where all the restrooms are, and you hope you make it home.
Right,
So,
right. And in the time you've been coming here, you had one issue, and
Yes.
you think it was related to something that you ate. Wow. And then how's that back pain doing?
better.
Good. And the leg pain's gone now, right? Is that right?
I haven't had any, those horrible stabbing pains in my feet wake me up at night, and my sleep habits were interrupted.
Right.
Because you get those cramps in your legs, and you're trying to sit up to massage your legs, and it's
Oh, it's miserable, isn't it?
Yeah.
Yeah, good. So irritable bowel syndrome much better, back's much better, no more pain in the legs, no more pain and problems in the hand.
Yes.
Sleeping better. So did this seem like to be a good idea to come here and get the care from Harper Health, Natural Health Solutions?
I think so.
Good. Okay.
It seems like you cover everything, and I haven't had that treatment.
Oh,
I've been to another place, and they covered, it was my balance more they worked on,
I
but
see.
not and I was facing surgery in one hand, and then later on in the other hand.
Right. So they wanted to do surgery thinking that you had carpal tunnel.
Yeah.
And did we ever touch your wrist? I mean, did we do any treatment on your wrist specifically? No. So that's not where the problem was. So you would have gone and had surgery and still had your problem.
And the feet and legs.
And
yes.
the feet and legs, right. So one of the reasons, Dorothy, why I like to do these testimonials is that people are skeptical. They think, oh, I'm too old or I'm too far gone. Do you mind telling me how old you are?
Well, I'll be 89 next week.
89,
Yeah.
isn't that amazing? Now, I marvel at how well the body can heal itself once it's given the right things. You know, have you ever heard that some people say peripheral neuropathy can't cure it, can't fix it? Have you ever heard that before?
No, I haven't.
I hear it a lot. People say, "Oh, you can't help me," and I'm sure you've heard that people say, "Oh, I'm too old. I can't get any better." Right?
I hear that all the time.
You hear that all the time, but you tell them different, don't you?
Yes. Well, I do Qigong exercise, and I try to keep busy. And the diet, once I realized that I was eating the wrong thing, and I'm a sweetaholic.
Right.
And so now I found other things that the grocery store, you can still have your sweets if you use the right product.
Exactly.
Which I didn't know exists before.
Right, yeah. So we were pretty thorough with the blood work and explaining all the things you needed to eat and how to eat and all that, and we were all clear about that. So
I've never had so much blood work and found out, exactly what was wrong with me.
Yep.
And my eyesight has improved.
Yeah, isn't that? Yeah, did you tell me that they were thinking about doing eye surgery on you?
Yes.
And you gotten so healthy now that the doctor just told you just that the other day, right?
Yes.
That you don't have to have
today.
surgery. Oh, today? Oh, my gosh. Well, yeah, congratulations.
Oh, thanks.
Good. All right. Well, that's great. Well, just two last things is you're heading off on a trip, right?
Yes.
I bet you're looking forward to that, feeling so good and being able to, not worry. Yes. Are you going to make it? Are you going to survive? You're going to be able to drive. So that's all really great. And
well,
good for you.
Flying, but then we'll do a lot of things when we get there. And my relatives are all happy that I'm off watching my diet, eating the right things.
Right. And you also, your medical doctor's taking you off some medication too, right?
Yes.
Yeah, you don't have to take the medication anymore because you're so much healthier.
Yes.
That's great. Good. Well, hey, Dorothy, I just want to say thank you so much. I so appreciate you taking the time today, and I'm so glad that you had great results here in our office, like the vast majority of our patients do.
Well, I feel like you're friends, and I can talk to you, and just it's just really been nice.
Great, real good. And along those lines, how do you like the staff?
They are super.
Yeah.
They don't rush, and you ask questions and they answer them, and they're just really friendly. It's not like you go in and they'll say sign in and that's it.
Right. Yeah. Everybody knows your name and they know who you are, and they're glad to have you back. So am I. So well, thank you very much, Dorothy. I do appreciate this taking this time.
I hope I didn't break your camera.
No, Dorothy. I have a feeling you did something really great just now. So you have yourself a lovely day and a fantastic trip.
Okay. Thanks.